Afternoon and welcome. Thank you for sharing your time with me today. And today we're going to be talking about SimplyOne from Security Health Plan, which is part of our individual family plan options that we have available for you. So SimplyOne is available in specific counties, and you can see here the map of Wisconsin, and those golden yellow counties are the counties that a person must reside in order to purchase the SimplyOne program. So you can see that is going to be Adams, Clark, Florence, Forest, Juneau, Langlade, Lincoln, Marathon, Menominee, Portage, Price, Oneida, Shawano, Taylor, Vilas, Wapaka, and Wood County. So again, that means you would need to be a resident within those counties. Now we'll talk in a little bit about the network of providers for you to utilize, but I wanted to make sure that you are in those counties so you can get the most benefit from today's presentation. All right, all of our SimplyOne plans, we do offer both on and off the marketplace. Again, many of you may call the marketplace or hear it called many different things. It's also called the exchange or the ACA or even Obamacare. Some people still call it that. And that's fine. It's all the same thing. But we have it available both on and off. So either way, you can purchase that through Security Health Plan. And what's great is you get to continue to use the Marshfield Clinic health system as your provider. So whether it's right in Marshfield or if you are up in the northern area, in Minocqua, of course, we've got clinics in Merrill and so forth, all throughout those counties, you can use any of those Marshfield Clinic locations to receive your care. Now, we do have some additional providers that are also part of the network that provide services for home infusion care, skilled nursing, chiropractic care, mental health, autism clinics, home health services, and dialysis services. So we do have above and beyond the clinic for those specific services mentioned there. Now, if you're ever unsure if your doctor or provider is part of the network for SimplyOne, I encourage you to go online to our webpage, securityhealth.org, and at the very top it says, find a doctor or provider. You can click on that, choose the SimplyOne plan, and it'll bring up those providers for you. But remember, if they are part of the Marshfield Clinic health system, they will be considered in network. So that's over 170 specialties, 60 clinic locations, and 10 hospitals, including the region's only children's hospital. So again, a great provider for this program. Now let's talk about the benefits itself. If you did tune in to the previous webinars we had, you may already know some of this information, but I think it's valuable, and it's another piece that we want to make sure we cover when we look at the SimplyOne plan. So we do cover all essential benefits on the SimplyOne plan. So that's going to be the outpatient care. Emergency services is also covered worldwide, along with urgent care, hospitalizations, maternity and newborn care, mental health and substance use disorder services, your prescription medications, rehabilitative and habilitative services and devices, your labs, so your blood draws, your preventive and wellness services, and chronic disease management services. And I'll get into that more in detail as we go along, the different ways that we can help people stay healthy. And if you do have a chronic condition, how we can make sure that you're getting the care that you need. And then, of course, also for the little kiddos, we've got the pediatric services, including oral and vision care. So that's all included in the SimplyOne plans. But we also cover preventive care services. These things are paid for at no copay, no out of pocket. So even if you haven't met your deductible on your plan, or if your plan has a co-insurance or a copayment, these particular preventive care benefits will not have a cost to you as long as it's done, again, in network. So some of those services are diet counseling, immunizations, blood pressure screening, colorectal screening, cholesterol screening, type 2 diabetic screening, hepatitis C, HIV screening, lung cancer screening, and screening for sexually transmitted diseases. So these are all things, again, that are part of the preventive care package at Security Health Plan. But we do things a little bit different, and I think better, because not only do we offer those services at no cost, but we also cover things that typically other insurance companies would not pay for at no cost. So for example, if a person has been diagnosed with a condition and they go back in for a lab, other companies will then have that lab benefit go toward the policy's deductible or coinsurance. Where at Security Health Plan, we still pay for those lab services as a preventive benefit and then at no cost to our members. So that's a great difference of Security Health Plan. Sorry, I muted myself. Didn't mean to do that. All right, so let's talk again about the members only website. So this is through My Security Health Plan. If you already have that app on your phone or access through your computer, great, you've already got that set up. If you don't, I really encourage you to do that because it's kind of your in to check on all different types of healthcare information. You can look at your scheduled benefits, your policies, you can track your healthcare spending by being able to look at your explanation of benefits or your statements. And then you can also keep tabs on how things are going with your claims, or if a provider put in a prior authorization for you for a service or a medication, you can also check the status on that. Also nice, you can go ahead and pay your monthly premium if you have one right through that website as well, or that app. And then you get the access to the perks. And we're going to talk about these in more detail: the Care My Way, the over-the-counter credit, and many more. Also with the My Security Health Plan app, you can go in and check your network of doctors. So as I mentioned before, you can either go online or you can go onto the My Security Health Plan and log in, and you can look at all the different doctors that are in network. Maybe you need a new ID card. You can request that there. You can also look at it there if you should need your subscriber or member number. And you can even chat with our customer service. So if you have a question and you just want to quickly see if somebody can respond, there's a chat feature on there and you can absolutely do that. Or you can send a secure message as well through email. And then of course they will reply to you on that. It also gives you ways to get advice on certain conditions. Our 24-hour nurse line is available there, along with email for that. If you don't have time to chat at that moment, you can email the nurse line as well. So let's talk a little bit more about the nurse line. All of our plans, including the SimplyOne, provide access to our 24-hour nurse line. So you can call anytime. Doesn't matter if it's a holiday, 7 days a week, anything. If you have a question, you're not sure if you should go in to see a doctor or go into urgent care, or if it's something that they can assist you with from home, certainly take advantage of this. This is a great service. And again, there's no cost to you for that service. All right, and part of that goes into the Care My Way benefit. So Care My Way is a service we provide. So let's say you do know you have a certain condition or there's something going on and you call into the nurse line and they say, you know what, let's have you speak with a nurse. You can speak with a nurse right there. You can do it through the mobile app or you can call in, many different ways to access that. But then that saves you the time and the hassle of having to get bundled up if it's the winter time and go in and see someone. And of course, if it's something that they can help you with, they could even send a prescription right to your pharmacy. So then you don't have to wait to get a prescription. Again, this is a wonderful feature. It's unlimited visits and it's at no cost. There's no copayment, no deductible applies. So again, a great benefit to utilize. Now let's talk about the over-the-counter credit. Excuse me. You will receive $120 for each person on the plan, or each, I should say, plan subscriber, of free products. And these are over-the-counter items, things like Band-Aids, cough drops, eye drops, paste, acetaminophen, different vitamins, things that you would probably purchase anyway, but now you'll get that through your health insurance. So each quarter you get $30 to use in those items. So it's a great benefit. Please make sure that you kind of put a little ticker on your calendar each quarter so that you go out and place your order. And it's very easy to do that. Again, you go back into the My Security Health Plan app and you place your order there and it gets shipped directly to your home. There's no charge for any shipping. So again, a wonderful benefit on our SimplyOne plans. Now, I can never stress this enough. Security Health Plan does have world-class customer service and we have the awards to prove it. So a lot of times we hear, this company was, excelling in this area, or this company is working on, improving their customer service, whatever it might be. Every year we continue to get high excellence scores. And this is so important because that means we're doing the right thing for you as our customer. We're answering the phone in a timely manner. We're giving you accurate information. And if we have to look something up, we are returning your call as soon as possible with that information. So it's a big piece of your health insurance. I know we look at cost, we look at coverage, we look at what providers can you see, but you want to make sure when you have a question that you know you can depend on people there to help you. And that's what we're all about at Security Health. All right, now let's look at another perk, Global Fit. So this is really neat. It gets you discounts on different ways to staying healthy. So it could be discounts at different fitness locations, tracking devices, diet plans, fitness on demand. So you can go out and look at different videos or look at different recipes even of healthy eating. So it's a really neat benefit. There's no cost. You're automatically part of this program once you become a SimplyOne member. And then care managers, I mentioned this earlier. So we have a team at Security Health Plan comprised of different medical professionals to help you along the way, help you with questions you may have about your care, explain coverage limits to you, look at different treatment options available to you. Of course, we always encourage you to speak with your doctor before you make any decisions if you're going to change the way that your treatment is being delivered. But it's just another voice. It's another person to help you look through all the different options and make sure you make an informed decision. So this is available to any of our members. We have our nurse navigators and our care managers. So if you're ever unsure about a condition or you'd like to speak with someone, they can also help coordinate the care between your doctor and the clinic and Security Health Plan. So a great benefit available to our members. And then we've got our health coaches. And these are wonderful people. I talk with them almost daily about different things for myself, but you know what? They're there to help. And again, to get you on the right path. If you're trying to manage your weight or quitting tobacco, or you just want to be more physically active, they have different programs set up, again, at no cost to you to help you kind of get on the right path. Or if you're doing great, they'll have new ideas for you to try different things. Again, different recipes, ways to eat healthy and to manage stress. I know it's been kind of a stressful couple years here, so it's nice that you've got that backup, that support to help you along the way. All right, so this is a really neat. This is enhanced coverage for people who have insulins. We have a select diabetic list, or insulin list, I should say, where rather than having to pay the deductible for your prescription or a high copay for your prescription, there's a $25 cap on these certain select insulins. If you're not sure if your insulin is part of this program, again, jump online, go onto your My Security Health, or of course, give us a call and we'll be happy to look that up for you. And along with that, you also get the testing supplies covered at 100%. So again, that doesn't mean that you're going to have to pay anything out of pocket for these diabetic testing supplies. It's something that we offer above and beyond. And then starting next year, you will also receive 100% coverage on SSRI medications. Those are typically prescribed for someone who has symptoms of anxiety, depression, or other mental health or mood disorders. So again, this is a wonderful benefit. You don't have a copay, there's no deductible, no out of pocket. And remember with your prescriptions, to be sure that you are using one of the SimplyOne pharmacies. And of course, the Marshfield Clinic pharmacies throughout the area are part of that pharmacy network. And we also offer mail order through our pharmacies. So if you're someone who says, I live maybe up in Price County and there isn't a Marshfield Clinic pharmacy up there, you can still use the Marshfield Clinic pharmacy in Marshfield and we'll set up a mail order for you. So you, of course, get the lowest cost available, because that is really important. As you look through the different plans, if you use the Marshfield Clinic pharmacy on some of the plans that have a copay, you'll pay half the price. So it's absolutely worth it to check it out, to save yourself some money. And of course, it's coming from the clinic pharmacy, so you're going to get the right information and the right prescriptions. All right, so that's what's mentioned here at the very top. Also, if you go through the Marshfield Clinic, you'll get 30% off the select eyewear there. So check it out. There's many different optical shops at different Marshfield Clinic locations. And then, of course, you also have access to our Marshfield Clinic's patient navigator program. What this does, it kind of helps you go through the system. So maybe you want to see a specialist or someone referred you for physical therapy. So what the navigator can do is make sure you can get in and get those appointments set up and that you don't have to be stuck in the middle of things. They do that for you. So it's a great benefit for our SimplyOne members. All right, also something that's new for next year is Ask Marsha. So, you know, we all, at least I know, I use Siri on my phone and other things to ask questions. Ask Marsha is a little bit different though. What you can do is where you can go in and rather than having to search 10 different websites to try to diagnose something that's going on with yourself or a family member, you can go right into the My Security Health and look at the Ask Marsha. And they do all the work for you. And they'll come back with results stating, okay, based upon the symptoms you said, these are some of the possibilities. So it's nice. Like I said, it gets the work done and you get the answers. And we also have video chat with a registered nurse at no cost. So if you say, okay, I kind of want a little bit more personalized care. I don't just want a search, I want to speak with someone online. We have that available too. So great benefits and ways to really save time and money so you don't always have to go in if you have some questions you'd like to discuss. All right, so what you need to apply, of course, you always have to have your social security number or document numbers for any legal immigrants who need coverage. That would be for anyone on the plan that's applying. You're also going to need to know the income for your family. So if you're working and your income is based on that, you're going to want to know what your income is or your pay stubs. Your W-2 forms may help you, any type of wage or tax statement, and any other form of income. So it could be rental property income, anything else that you're receiving income on from your taxes. And then any information about a job-related health insurance plan, because we need to make sure that if you are applying for a SimplyOne plan and you do have coverage offered to you through an employer, that you are getting the correct plan. Because typically you would then take the plan through your employer if the amount that you pay is going to be less than 9.6% of your yearly income. And I know that's a lot of detailed information, so let us help you. Give us a call. We can work through that with you. And then lastly, an email address, because of course this is all done online. When you can apply, the open enrollment started November 1st. So just this last Monday, 2 Mondays ago, it will continue until January 15th. So this is an extended period. But keep in mind, if you want coverage to begin January 1st, you have until December 15th to complete the application. Okay. If you then apply between December 16th and January 15th, then it would start in February. Okay. So during this time is when you can review your plans, see if you are going to have a new tax credit, because if your income has changed, that could change your premium. And also the tax credit amounts change each year. So you could even have a lower premium than the previous year. So you can always go online and check us out there, or again, you can give us a call. You can call us at the number listed here, the 855-862-6859. Again, you can go online or you can send us an email with the information that you're looking for, and then we'll be able to send a quote back to you. So it's a real easy way to get the information, and we're always here to help however we can. And before I open it up for questions, I just want to thank you all. I know some of you may have to be on your way, so I want to thank you very much for listening and tuning in. And again, if you have questions after today, please reach out and let us know. Are there any questions?
Hi, I have a question.
Yes.
Sometimes when you're researching the differences in plans on the marketplace, it's hard to figure out some of the differences. I took a plan I'm on this year, and at some point, once I was using the plan and it was in effect, there was some clause about everything being medically necessary. And I'm like, well, that wasn't anywhere that I read when I was signing up. So I'm just kind of curious, what's a good method when you're researching, or is it better to go through you? Because then you can tell us how to find that plan on the marketplace.
Right, absolutely. We want to help you. So yes, we can help you. As far as, what you talked about, the medical necessity. So that is something that is on any of our security health plan products, is it is based upon medical necessity. So things that would not be covered would be, investigational, experimental, cosmetic, those types of things would not be covered, or things that are not medically necessary for another reason, just to address that part. But yes, certainly, if you have a specific benefit question or you're trying to compare things, call us, let us help you. We can certainly do that. We can even do Zoom meetings, things like that, so we can see each other and share the screens.
Thank you.
You're welcome.
Okay, I had a question come in about Ask Marsha,
Okay.
and I think I've got the answer. It asked about where you can access Ask Marsha, and you can actually access Ask Marsha, oh, a lot of A's, through your Marshfield Clinic Health System mobile app, My Marshfield Clinic, but that isn't happening until 2022, but that's just around the corner. So
Right, that's exactly right.
just wanted to clarify that.
Sure.
I don't see any other questions through the chat feature.
Okay.
I suppose maybe we can go ahead and close it out then.
Sounds great. Again, thank you, everyone, and reach out. Let us know how we can help.
Okay, I did have one question just come through. It says, hi, wondering if preferred drugs are considered tier 2. And no worries.
Yes, so preferred drugs are really going to be, if they're generic, they're 1 or 2. If they're brand name, they could be 3. So typically, yes, preferred would be considered tier 2, but we can always talk about that specific medication if you give us a call or let us know. And I
Okay.
did see another question came in.
Okay, good.
Okay, so yes, on the previous Zoom meetings, we did talk about the income levels. So yes, the tax credit is based upon income, zip code, county, people on the plan. We have, in order to get a cost share reduction, which means your deductible will be smaller, as well as getting a tax credit, you would want to make sure that you're on a silver tier plan. Okay, so on some of our plans, we do have the lowest cost, premium cost, and cost share available out of all the other carriers out there. That is our second lowest cost plan on our silver plans. But if you're just looking at getting any type of cost reduction, it has to be a silver plan. And the tiers, for those of you who are not sure, that there's different metal tiers. So, there's going to be gold, which is going to be your smallest deductible. Silver is more of the mid-range, and that's where you could possibly qualify for a cost reduction on your deductible and your out-of-pocket. And then we've got the bronze, which is typically the higher deductible and lower premium. So if you're looking for that silver plan to see if you qualify for a cost reduction, yes, when you put in your income information, it will automatically generate that for you. So you don't have to look through each one. It'll show you all 9 options that you qualify for. And then if you qualify for that cost reduction, it'll show you that as well on the 2 silver plans we have. I hope that answered your question.
Okay, and we might now be able to come to a close. So,
Good questions though. And again, give us a call and we can help you on the phone, or you can send a email afterwards, to the same link that you got before. Thank you.
thank you, everybody.